Hi, my name is Eileen Knoll, and I am a school nurse at an elementary school. And today we will be talking about two main types of diabetes, type 1 and type 2. In our patients with diabetes, they may have pronounced, subdued, or even absent signs of symptoms of weight loss, weight gain, polyuria, polydipsia, polyphagia, constipation, fatigue, cramps, blurred vision. Long diagnosed patients are more susceptible to vascular disease such as coronary artery disease, heart disease, and peripheral vascular disease. Major complications of diabetes include dangerously elevated blood sugars, abnormally low blood sugars due to diabetic medications, and diseases of the blood vessels which can damage the eyes, kidneys, nerves, and heart. Comorbidities are obesity, hypertension, high cholesterol, obstructive sleep disorder, fatty liver disease, cancer, and fractures. Pathophysiology of type 1 diabetes is when the beta cells are destroyed caused by an autoimmune process, usually leading to the body's inability to produce insulin. Treatment for type 1 diabetes involves taking insulin, which needs to be injected through the skin into fatty tissue. Type 2 diabetes is the impaired insulin secretion through a dysfunction of the pancreatic beta cells and impaired insulin action through insulin resistance. Insulin is needed sometimes. With type 2 diabetes, the pancreas usually produces some insulin, but either the amount produced is not enough for the body's needs or the body cells are resistant to it. The golden standard for the use of diagnostic is the hemoglobin A1C blood test, which estimates glucose levels in the body or the blood over the last 3 months. It's used to help identify overall glucose level controls and the risk and complications from diabetes, including the organs. Other diagnostic test is a blood glucose testing that should be done regularly. Diagnostic criteria for diagnosis of diabetes by the American Diabetic Association includes a fasting plasma glucose of 7 moles or higher, a random plasma glucose of 200 milligrams per deciliter or higher, especially in patients with classic signs and symptoms of hyperglycemia. Common medications and mode of actions are short-acting insulin starts within 30 minutes after injection, peaks 2 to 3 hours, and lasts 3 to 6 hours. Common one is Humulin and Novolin. Rapid-acting insulin acts within 15 minutes, peaks at 1 hour, and lasts 2 to 4 hours. Common ones are Novolog, Lexapro, and Humalog. Immediate-acting insulin starts 2 to 4 hours after injection, peaks 4 to 12 hours, and lasts 12 to 18 hours. Common ones Humulin N and Novolin N. Long-acting insulin starts several hours after injection, does not peak, and lasts 24 hours or longer. Common one is Lantus. There are combination insulin mixes. There is also oral medication. The most common one is metformin. Can have drug interactions caused by prescription drugs, over-the-counter medications, herbal products, vitamins, food, diseases, and genetic disorders. There is no cure for diabetes. Type 2 diabetes can be controlled with weight management, nutrition, and exercise. Diabetes can be genetic, but is more based on the biology of the individual and their lifestyle. Environment and lifestyle to prevent disease or complications would be periodic or frequent hemoglobin A1Cs every 3 to 6 months, a yearly dilation eye examination by an optometrist, and every time they go to the doctor should have their feet examination every single time. A blood pressure of less than 130/80 to prevent the diabetic neuropathy. Lifestyle of a diabetic patient will have to conform to healthy eating, meaning learning about carbohydrate counting and portion control, coordinate their meals with their medications, exercise regularly, check their blood sugar frequently through the day. The cost of medication can be the cause of reason why patients have uncontrolled diabetes. In conclusion, diabetes is completely manageable with proper routine, regular scheduled visits to the doctor, and proper education on the disease process and treatments. Thank you very much.